Welcome to the BanishCancer podcast. I'm Rachel, joined by James, the cancer wellness educator. Today, we're diving into a question that sparks a lot of curiosity and sometimes fear. Can surgical scars lead to cancer? It's a topic surrounded by myths, but also by fascinating new science.
Thanks, Rachel. It's a great subject to unpack. The short answer is reassuring. Most surgical scars do not become cancer. The risk is very low. But there are exceptions, and understanding them helps people know when to be cautious and when they can relax.
Let's start with those exceptions. Which scars are the ones that deserve closer attention?
Burn scars are the most notable. They've been linked to a higher risk of cancer in some cases, especially when the wound didn't heal properly. Chronic inflammation seems to be the driver there. Another type is keloid scars, those thick raised scars that grow beyond the original wound. Research suggests people with keloids may have a slightly higher risk of certain cancers, including skin cancer and, in women, pancreatic cancer.
So while most scars are harmless, burn scars and keloids are the ones to watch. But I know the science goes deeper than what we see on the skin.
Exactly. Researchers now talk about two kinds of scars: physical scars and DNA scars. Physical scars are the visible marks after surgery or injury. DNA scars are tiny changes left inside our cells when the body repairs damaged DNA. Most of the time, DNA repair works well, but sometimes mistakes leave behind what scientists call mutational footprints. These DNA scars can influence how cancers develop and how tumors resist treatment.
And that's where the idea of the human repairome comes in, right?
Yes. The repairome is essentially a catalog of all the DNA repair marks in our cells. By studying these patterns, doctors hope to design more personalized cancer treatments and even predict who might be at higher risk. It's a cutting-edge area of research that could change how we think about prevention and therapy.
Let's bring this back to everyday life. If someone has a surgical scar, what should they actually do?
The most important thing is monitoring. Check your scars monthly in good light, use a mirror if needed, and look for changes in color, size, or texture. Watch for new bumps, ulcers, or sores that don't heal. Pay attention to itching, pain, or bleeding. Taking photos can help you track changes over time.
And if you notice something unusual,
Don't wait. See your doctor. Early detection makes a huge difference. Most scars are safe, but if one darkens, thickens, bleeds, or becomes painful, it's worth getting checked.
what about prevention? Is there anything people can do to lower their risk?
Absolutely. Good wound care is key. Keep incisions clean and covered while healing. Use doctor-recommended ointments or silicone sheets. Protect scars from the sun, and treat any signs of infection right away. These steps reduce chronic inflammation, which is the real driver of risk.
I've also read that scar tissue can affect the tumor microenvironment, making it harder for the immune system to fight cancer.
That's right. Scar tissue can thicken the area around a tumor, creating a barrier that immune cells struggle to cross. This is especially true in aggressive cancers like glioblastoma, where tumors often recur in scarred brain tissue. It's one reason researchers are studying how to target fibrotic scarring as part of treatment.
There are also a lot of myths around this topic. Some people believe all scars eventually turn into cancer.
That's a myth. Only a tiny fraction of scars ever become cancer. For example, burn scars account for a small percentage of certain skin cancers. The overwhelming majority of scars heal without leading to cancer. The key is balanced awareness. Know the signs, check regularly, and act early if something changes.
For those with keloids or a family history of keloids, what extra steps make sense?
Keep up with regular skin checks and consider dermatology follow-ups. If you've had breast surgery, follow recommended imaging schedules, a baseline mammogram after recovery, then annuals, or alternating MRI and mammogram for higher risk profiles. If you carry genetic mutations like BRCA1 or BRCA2, your team may advise tighter surveillance. Personalized follow-up matters.
Before we wrap up, let's remind listeners of the key points. Most surgical scars are safe. Burn scars and keloids deserve closer attention. Chronic inflammation is the real risk factor. DNA scars, those repair footprints, are helping scientists personalize future treatments. And your best action plan is simple. Care for your wounds, Check scars monthly and speak to your doctor if anything changes.
Exactly. Awareness without anxiety. The goal isn't to worry about every mark on your skin. It's to know what's normal for you and to notice when something isn't.
James, thank you for breaking this down so clearly. And thank you to our listeners. This has been the BanishCancer podcast. If today's conversation helped, share it with someone who's recovering from surgery. The more we understand, the safer we are.